Welcome to WakeGov TV. I'm Eric Curry. We have several stories lined up for you today. There are a number of new programs for Wake County employees designed to cut health costs, plus important information you should know if you're a pet owner. Details coming up. But first, the Board of Commissioners recently received an update from Wake County Human Services on the implementation of the NC-FAST program here in Wake County. NC-FAST is a program designed to improve the way the state's Department of Health and Human Services and county departments do business. However, due to an overwhelming demand of services coupled with technical glitches to the system, Wake County staff has experienced a backlog of cases, which has required additional staff and overtime to catch up. The system is constantly being updated by converting and consolidating information into the integrated system that is intended to improve efficiency. With us to talk about NC-FAST is Liz Scott, Assistant Social Services Division Director for Wake County Human Services. Thank you so much for being here.
Thank you for having me.
I guess NC-FAST, it's a software program issued by the state. What were the goals for this software and what was the intended purpose when it first began to roll out?
The intent of this technology really is to improve access for customers that are trying to apply for different kinds of economic services benefits. People can now apply online from their homes or from other locations to avoid having to come to our office. The other intended benefit of this system will be to consolidate all of the economic benefits into one system.
And what did the county do in preparation for the implementation of NC-FAST for food and nutrition services?
Well, we did a lot of training of our staff. They had to really learn an entirely new way to work because it's very different from the way they did business in the past. We knew that we would have a need to convert a lot of data, so we hired temporary staff. We mandated overtime for our staff because we wanted to try to be as caught up as possible when we went live in the new system.
Implementing any new system, especially when you're talking about technology, it can become very taxing and very challenging. What problems has staff experienced during the implementation?
Well, we have had really a number of problems. As you said, with any new system, there are going to be technical glitches as it's rolled out, and we certainly saw that. We saw slowness of the system, and we saw glitches that didn't allow people to get their cases to go all the way through. We also have a tremendous demand here in Wake County, and so we got behind because of the large numbers of people who are applying for benefits.
How can residents in need of these services make sure that the process, what can they do to help staff make sure that this process rolls as smoothly as possible?
Well, we are contacting people that need to provide us with additional information before we can process their case. We're doing this by phone calls, by emails, any way we know that we could get in touch with them. And if they have been contacted by us, we are asking that they bring in or contact us and get us the information as soon as possible so that we can get their benefits to them.
And we can never say this too many times. If someone from Wake County Human Services calls you about your application, answer the phone or return a phone call or reply by email. So important.
Very important. People can fax us information, they can email us information, they can bring it to us, but the important thing is we're trying to make the deadline, and we want them to respond as quickly as possible so they can receive their benefits.
And for residents that may be watching and are in need of assistance with their current status, or if they are new to the system, where can they get help?
Well, if they're new to the system, they can always apply online at epass.nc.gov. That's how they can file an application. If they have a question about their case, they can of course call our main number, which is 212-7000, but they can also email us, and I'm going to give you the email address, and that is mysocialservicescase@wakegov.com. And that way they can email the question instead of trying to call. Sometimes it's very difficult to get through on the phone, and their question will be answered.
Well, Liz Scott with Wake County Human Services, thank you so much for being here to share with us an update on NC-FAST.
You're welcome.
Up next, we'll talk with the director of the county's Animal Center about rabies and how you can protect yourself and your pets from this deadly disease. Stay tuned.
They said I couldn't dream. Called me a piece of trash and swore that's all I'd ever be. Said a bottle couldn't see the ocean. Give up. Go back to the dumpster. But I didn't listen. I made my way. And now, I am what I've always wanted to be.
Welcome back. According to the Centers for Disease Control and Prevention, rabies is a preventable viral disease of mammals often transmitted through the bite of a rabid animal. The vast majority of rabies cases reported to the CDC annually occur in wild animals like raccoons, skunks, bats, and foxes. While most cases of exposure are between animal to animal, humans have also been exposed by being attacked by rabid animals or being exposed unexpectedly by family pets through a bite or scratch. So what should you do to protect yourself from this deadly disease? Joining us today to talk about it is Dr. Jennifer Federico, Director of the Wake County Animal Center. Thank you so much for being here.
Thank you for having me.
First, what's the biggest misconception about this disease?
So a lot of people think we can test for rabies, and we can test for rabies. However, the animal must be euthanized first. There's no ante-mortem test. So unfortunately, it's much better to have your pets vaccinated, because otherwise we will have to euthanize them to actually test for rabies. So that is the biggest misconception among pet owners. The other second misconception is people feel like if their animals live inside, there's no risk to them. This is especially true among cats and some small breed dogs that owners say, well, they just go outside in the yard and they come back in. But we have so many cases of bats in households, and bats can transmit rabies and therefore expose those animals as well. And you never know if your pet gets outside. So it's better to have them vaccinated and keep them up to date.
And I'm sure you receive, unfortunately, some cases of pet owners knowing that their own pets may have been in contact with a wild animal, and they just tell you, well, you know, the animal did look a little funny, but my dog or cat is okay. You can't just go by their word.
No, unfortunately, if they become exposed to wildlife, ideally we would be able to either trap the wild animal or their pet has killed it and we can test it. Sometimes though, that wildlife runs off and there's no way for us to trap it. And with that exposure, it's assumed positive, which means that not having the animal means it's positive, and now we have to treat their animals as exposed. And that's really frustrating for owners, especially if they're not up to date, because it gives them only two options really. If their pet is exposed, they either can, at their own cost, quarantine their animal for 6 months at a private veterinary facility, which will cost upwards of $5,000 is what we're getting estimates for, even up to almost $10,000, or euthanize their pet. And it's two really awful options to have.
It is.
And those are just for unvaccinated pets. If they're vaccinated, they just go and get a booster and they're good to go. So you really want them to be vaccinated.
Definitely. While most people talk about rabies prevention during the warmer months, and it's obvious because more folks are outdoors, going through wooded areas, what have you, even letting their pets run free in the rural parts of the county. People need to understand that this virus just doesn't sit dormant during the winter months.
No, it doesn't. It's year-round, and you can be exposed at any time of the year. So no matter what time of the year, you need to take the same precautions.
So when there is a case of a possible rabid animal found in anyone's community, neighborhood, what is the process to verify that if the animal is rabid?
So if we're talking about wildlife, animal control officers will go out and get the wild animal if available. If they can trap it, it comes to the animal center. It is humanely euthanized and then sent to the state lab for rabies testing. Once we get those results back, we can let the family and the pet owners know, or if the owners were exposed. That is the step if it's a wild animal. If it is a domestic animal, if your dog bites another dog, we're not quarantining your dog. If your dog bites you or another person, we will quarantine a dog or cat for 10 days. If they don't show signs of rabies within those 10 days, they're not spreading the virus at that time, and you're safe, and then we release the animal back to the owner.
And what are some of the signs during this quarantine period that you look for?
We look for any signs of neurological disorders such as ataxia, so stumbling around, aggression, just changes in behavior is really what we're looking for. And we don't vaccinate them on intake for rabies until they finish their quarantine, because even some vaccine reactions could look similar to rabies, and you don't want to take that chance of making that mistake.
So what can citizens do to protect themselves and their pets?
Keep your pets up to date all the time. It is the most important preventive care for your animal. If you just put it like an index card on your fridge with your rabies dates, because you don't want to ever be overdue. So that's for your pets. The other thing for your pets is making sure that they're under your control. If they're running free, you don't know if they're getting exposed to wildlife. Keep them on a leash. Watch them if they're out in your yard, if it's not fenced. Take those precautions. As far as people, teach your children not to go up and play with wild animals. And when I say wild animals, that includes unknown animals. So the stray kitten, the feral cat, could all be vectors. So call animal control, let them pick up the strays, so your family's protected. And also if you see any wildlife that is acting abnormal, and when I say abnormal, if it's more aggressive, if it's out during the day acting abnormally, call animal control. They're the best ones to come out and evaluate that wildlife to say, yes, this is something that I'm worried about for rabies, or no, this is normal behavior. But don't bring the wildlife in your house. Just leave it out where it belongs and appreciate it from afar.
Now, is it true that most wildlife, such as raccoons, possums, if you see it during the day, that is probably not normal in neighborhoods if they are not afraid to approach you during the day?
Yes, but dusk is a little different. So we sometimes have people call it dusk, and that's when sometimes the moms will go out. So animal control is the best to say yes or no, and depending on what that animal is doing, but never approach it, never try to touch it. If it's hurt, leave it, call animal control, because that's even more of a risk factor for you to get bit.
Now, what if a pet comes in contact with a rabid or suspected rabid animal, and the pet owner notices this, whether it's a fight or what have you? What is the best way owners should prepare that animal to be taken to your center?
So first, you want to call animal control. Let them know what happened. So animal control can come get the wildlife. Then they'll also talk to the owner and say, okay, is your pet up to date on rabies? They'll look at the documentation and your proof. If your pet's up to date on rabies, they'll say, okay, you know what? Go to your veterinarian within 3 days and get a booster. That's it. That's all that will need to be done with your pet. Now, if the pet is not up to date on rabies, they'll get the wildlife tested and then tell them about quarantining or euthanasia.
So how can citizens find out more about this important health issue?
So the CDC has a wonderful website at cdc.gov, and citizens should also be having annual visits with their veterinarian, and your veterinarian is a great resource for information on how to protect your pet.
Dr. Jennifer Federico, Director of the Wake County Animal Center, thanks again for being here.
Thank you.
Coming up after the break, we'll take a look at a new initiative to make Wake the healthiest county in the state of North Carolina. Stay tuned.
So school's out and you're looking for ways to keep your kids entertained and happy? Carey offers camps and programs that appeal to even the most unique imagination. Get the School's Out 411 from the pros.
Camp was a lot of fun and I loved the teachers. I learned a lot of fun things. I really enjoyed camp because I made lots of new friends.
I love it when the kids come to class and they have so much fun.
I love making new friends.
The town of Carey has the 411 when school's out. Registration starts February 7th. Camps fill quickly.
Wake County is known nationwide as one of the best places to live, work, and play. Now this area is also known as one of the healthiest. The National County Health Rankings Project recently ranked Wake County as the healthiest in the state for the 4th year in a row. The county has embarked on the Healthiest Capital County initiative, designed to improve the health and well-being of all county residents by working with community and private partners. County leaders recently hosted a kickoff event in Raleigh to promote the initiative.
We have been ranked the #1 county in North Carolina for 4 years in a row, but we still have some issues and we want to get better. And to try to get better, we developed this initiative called Healthy Capital County, trying to really improve in a lot of indicators and in practical terms, try to help citizens live healthier lives and be healthier.
Today we are launching a friendly competition with our peer capital counties across the United States to become the healthiest capital county in the nation. While a friendly competition helps motivate and inspire people, it is of course about a lot more than that. It's about helping people in Wake County to be healthier.
I've been on the road with the county health rankings and roadmaps for almost 5 years now. And I think this might be the first time I've ever been invited to a county in the state that ranked the healthiest. Because many times the healthiest counties are like, yeah, we got it. Good. And you should. I mean, I absolutely want to celebrate with you the great work and the great partnerships and the great investments that you've made in your community to be the healthiest county in North Carolina. But I think what this acknowledges is y'all know there's more to be done. And it's so appropriate that we're having this meeting today on the morning of the opening ceremonies of the Olympics. Because just think, you are just like those athletes. Every one of those athletes in Sochi is not just going to win a gold medal, but they're going to set an Olympic record, to set a world record. So there's always that next step to strive for. Wake County, as we know, has ranked the healthiest county in North Carolina all 4 years that we've released the county health rankings data. And so the first thing that impressed me is that as a healthiest county, you still care about getting better. The second thing that really stood out to me when I looked at the work you've done is you're very data-driven, and you've already looked at additional data beyond the county health rankings to further understand what your needs and priorities are. And the third thing that really impressed me based on that review of the data was that you've really looked at all the factors that influence health. And so much of the time when people do a community health assessment, they stay very, very focused in clinical care or disease-oriented priorities, or maybe health behavior priorities like healthy eating and active living. But here in Wake County, you guys have taken on and set issues like poverty, unemployment, improving educational outcomes, addressing mental health issues are important priorities for health. And so that's really impressive. And I guess the last thing I'd say is you get that it takes, if you're going to look at poverty and education and things like healthy eating and active living, it takes everybody to be at the table, and you've done a really great job of bringing people together from so many sectors to attack these issues and move you to the next level. If people want to find out more information, they can visit our website, which is countyhealthrankings.org. At that website, they'll find information and data about every county in the United States. There's a map of the U.S., and they just click on their state and click on a county, and it'll all be right there for them. They can also find stories of other communities that are taking action to improve health, and those could be inspirational to you and what you might want to do next. And then there's also, under the Roadmaps tab, a variety of tools and resources for thinking about what action you can take, both as an individual or working with your neighbors, for how to improve health in your community.
Okay, so we drowned the fire, stirred it, drowned it again, and now just feel if it's cold.
Yeah.
Cool.
Smokey just gave me a bear hug.
I know. I already posted it.
Welcome back. For millions of Americans today, the cost of health care continues to be one of, if not the major concern as we look to reduce costs in a recovering economy. And for many of us, employee-sponsored health insurance can be a cost-saving benefit. But with the rise in health care costs, Wake County government has taken a big step in helping to promote healthy living among its employees and has improved the health of employees while reducing health care costs even further. From sponsoring employee 5K events, which I have never taken a part of, to starting a diabetes prevention program, Wake County leaders hope it will benefit both the Wake County employees and citizens by reducing what's spent in the doctor's office or in a hospital. With us to talk about this important initiative is Caroline Hipple, Benefits Specialist and Wellness Coordinator with Wake County Human Resources. Thank you so much for being here.
Thank you.
Caroline, can you first tell us how this initiative all began?
Well, here at Wake County, our wellness program officially started a little over 6 years ago, which was the same time that healthcare costs throughout the country were really starting to skyrocket. And employers were having to take a step back and think, what can we do to help manage these costs while still maintaining coverage and affordability for employees? So here at Wake County, we really wanted to shift how healthcare was viewed. We wanted to change it from something that happened to you to something that you were a part of. So that's where the wellness program came in. We wanted to give employees the tools to easily make improvements to their health, and by improving their health, hopefully avoid the debilitating and often very costly diseases and illnesses that can come along with health issues.
What type of feedback did you get from Wake employees about this?
Employees have really embraced this as another benefit to working at Wake County. I think it's one thing to try to improve your health on your own. It's another thing to do it with the support and opportunities that our program can provide. We put out an employee wellness survey once a year to kind of gauge where employees are at, what they're interested in, where they want to go. And you know, everyone wants to be healthier in some small way at least. So sometimes it's hardest just to get started or to know where to start, and that's really where we come in. We hear all sorts of success stories from employees who have reduced their diabetes risk or lowered their blood pressure, or who just feel better after attending one of our programs. So that's really what we want to hear and what we want to get out of this.
And could you share with the viewers some of the programs offered to employees?
We offer a wide range of opportunities. We do everything from lunch and learns and seminars on a variety of wellness topics. We host on-site fitness classes for employees. One of our flagship offerings is our Living Well at Work Diabetes Management Program, which places employees with diabetes into support groups that are led by certified diabetes educators and coaches who help them better understand and know how to manage their diabetes, which is such an epidemic right now throughout the country. And that program has been hugely beneficial, both for the individuals as well as it's resulted in great cost savings on our diabetes-related health claims. We have the Know Your Numbers program, which encourages employees to get their preventive health screenings, to identify their health risk factors, hopefully before those turn into chronic and major issues. One of the more fun activities we do, as you mentioned, is the Wake County Employee 5K, which is a lot of fun. We have a lot of first-timers come out to that.
One day, one day.
That's a very motivational event because we have many people who train for the first time, who've never run a step before in their lives and come out. So that's a very popular activity. We also do challenges throughout the year. We've got a walking challenge going on right now where employees are wearing their pedometers to track their steps. And the goal is to get 10,000 steps a day, and people take this very seriously. People tell me stories about how they purposely take the stairs instead of the elevators, or park far away in the parking deck, or do a lap around the bed right before bedtime just to try to get those steps, which I think that's really the focus of our program. When wellness becomes something you want to do, that's our goal.
Yeah, I can say firsthand knowledge of seeing Caroline and another co-worker going up the stairs, 14 flights almost?
That's right, yes.
14 flights, and all I do is wave at you and say, I'm taking the elevator. But of course, you know, I'm joking about that, but it's that type of participation that makes or breaks any kind of program, any initiative. But what makes this wellness program successful?
Well, we already have a great culture of wellness here at Wake County. We've had excellent support from our Board of Commissioners and our senior management. They believe so much in this program that last year we were able to open an employee health center, which allows employees to have even easier access to health care at work. So it's accessible and affordable. That was a huge vote of confidence, and we would certainly need to continue that level of support. And on our side, on the program side, we need to ensure that our offerings are what the employees need and want based on the surveys, based on our medical claims, and adapt those as we go along, as the population changes, as the organization changes. We always want to have something fun and interesting because everyone has heard, eat your vegetables, exercise more. So we need to be sure to package those ideas in new and different and exciting ways. Because each individual has something different that will click with them, where they say, okay, this I can do, this I understand. So that's how we can keep up employee interest and make the program successful.
And of course, as citizens listen to you really talk about this program and what it means to the employees, there is a savings, though, that's passed on to taxpayers with the reduced medical costs, correct?
Absolutely, absolutely. The long-term effects are a huge benefit because taxpayers do subsidize part of our employee health insurance. So if we can help employees lose weight, eat better, reduce stress, stop smoking, then that will help lower the cost that comes along with caring for the problems that are part of unhealthy behaviors. So that's dollars saved rather than using them on health insurance claims, prescription drug claims. And I think a smaller but still very direct benefit to the citizens is that Wake County employees are citizens of Wake County. They have kids and friends and family that they go home to each night. So if there's one employee that can make a healthy lifestyle change, then that'll affect those that they are closest to. So if we have an employee who comes to one of our nutrition seminars and learns a new recipe and takes that home and fixes something healthy for their family that their family enjoys, then that's an immediate difference, and small changes can turn into lifelong habits, and that's really what we hope will make Wake County a healthier and happier community as a whole.
Okay, Caroline Hippel with Wake County Human Resources. Thank you so much for being here.
Thank you, Rick.
And thank you for joining us here on WakeGov TV. Keep up with the latest Wake County news by visiting us online at thenewwakegov.com/news or on Facebook or Twitter. That's our show for today. Thanks again for watching.